so much has happened since the beginning of this year that it takes quite a bit of searching to remember what it was like at the very beginning of the COVID-19 pandemic, when we knew that there was some sort of threat out there in the world, but we didn't really know how it would affect us here in Oregon. But that doesn't make those recollections any less vivid. And even with that uncertainty, or maybe because of it, Multnomah County was prudent enough to begin preparing for COVID-19 really early on, even before it had a name. Our county's public health division launched its initial response team on January 28th, just 1 week after the first positive case of the virus was recognized in the United States. And as circumstances would have it, it was just across the river in Washington. In the first few months of this year, there was a daily barrage of new information bombarding us about the virus, its health impacts, its symptoms and lethality, where it was spreading, and how it was transmitted. And yet, we still had so much to learn. Our public health leaders, like public health professionals across the country, were in the unenviable position of parsing the noise, identifying the facts, and figuring out what the risk was to our communities and what it would take to keep our residents safe. So here at Multnomah County, upon the advice of our public health team, we began confronting the possibility that the virus could and eventually would spread here in our own community. And as we learn more about COVID-19, sometimes the information was changing by the hour, it seemed. The outlines of the threat became sharper, and the possibility of the pandemic touching our community became more and more real. In those early days, as I continued to learn more about the virus, and more specifically about the types of precautions that lowered the chances of people becoming infected, my first thought was for the people in our community living without a home, outside or in our shelters. For most of our community, those precautions, wash your hands, stay indoors, keep 6 feet apart, those were simple steps to take. But for our unhoused neighbors living outside, they were logistical challenges or luxuries. Of course, as the county chair, my greatest concern is for the health and safety of all of our community members. But it was becoming clearer that the dangers of this looming viral pandemic were going to magnify existing inequities, and that the people living outside and without stable housing were poised to bear an unacceptable risk of harm. So from that point, the question that kept ringing in my mind as COVID-19 took over across our country was, how do we take care of our neighbors experiencing homelessness? That central question has been at the core of my agenda and my work since the day I was sworn in as a Multnomah County Commissioner in 2009. It's a deeply personal question for me and an essential question for our community. And it's one that has a lot of answers. Answers that reveal and define our community's values, answers that are questioned, criticized, or politicized, answers that at the end of the day can be the difference between life and death for people who don't have the safety of a permanent place to call home. Despite the countless nuances and complexities of this question, the first step toward building an answer is with the fundamental belief that housing is a human right. And then we work from there to figure out how to make that a reality. Soon enough, the possibility of finding COVID-19 in our community gave way to our first case. And as the pandemic began to spread little by little in our community, it became obvious that time was of the essence. Our community, especially the most vulnerable, couldn't afford for the county to respond tentatively or slowly. We had no choice but to be decisive. And I'm proud that Multnomah County responded quickly to care for people experiencing homelessness who are at heightened risk, not just for contracting the virus, but for the health impacts that make COVID-19 so dangerous. But because of the work that we've undertaken over the past 10 years, we didn't have to start from scratch. In fact, the only reason that we were able to act so swiftly and nimbly was because of the work that we've been doing for the last few years, trying to answer that central question. How do we take care of people experiencing homelessness? For 6 years, we built, tested, and strengthened the systems and tools we use to meet people where they're at, provide for their most immediate needs, and then give them the help that they need. We doubled our investments, and they paid off. And what we've built over the past few years laid a strong foundation for how we responded to make sure that we could care for our neighbors. And they are unmistakably, undeniably our neighbors during this once-in-a-lifetime pandemic. There are a lot of people out there who think that homelessness is a new or an emerging issue, and that the responses that they know about, be it homeless services agencies or local government programs, are even greener. But we know that couldn't be further from the truth. For as long as people in our community have struggled with poverty, mental illness, substance use disorders, involvement with the criminal justice system, broken family ties, marginalization, and discrimination, it's known homelessness. And while homelessness isn't a new issue, we also can't deny that more people are vulnerable to the circumstances that lead to housing instability right now than at any time in recent history. And that's largely because the safety nets and the social agreements that have historically acted as backstops before someone reached the point of homelessness, affordable but safe housing, accessible treatment for mental health and substance use disorder, disability payments that kept up with the cost of living, these backstops have been steadily and slowly chipped away. The inequality gap that keeps widening into a chasm, and local economic boons that don't benefit the community evenly, and flagging wages have only worsened the severity of the crisis. By the late 2000s, what many refer to as New Portland was taking shape as the local economy thrived. But underlying that growth was also increasing inequality and heightened desperation among those whose boats weren't being lifted by the rising tide. Against the backdrop of rising condos and ballooning rents, the public conversation around homelessness became increasingly callous, framing the issue as one of a nuisance or a blight, rather than as an actual issue of our neighbors being locked out of housing and other services necessary for their health and safety. The way people collectively thought about homelessness was also informed by our government, where too few local leaders showed political appetite to engage in the hard work of making meaningful changes to the way we supported the community of people experiencing housing instability. Still, I want to tell you that there was a lot of work being done among community organizations, passionate advocates, people with lived experience, faith groups, businesses, and the government to meet the needs of vulnerable people. Our goals were similar, but we weren't aligned or coordinated. And that meant that a lot of opportunities to serve more neighbors more effectively and more efficiently were being missed. So to build upon the work that was in motion and to leverage it into something greater, we formed a Home for Everyone, creating for the first time a new aligned network of current and former participants, service providers, government, business leaders, and the faith community, all aligned toward a singular goal: to end homelessness. When we started that work, we didn't envision preparing for a pandemic, obviously, but the systems and partnerships that we've built put us in the best position to handle a crisis like this. And at the very heart of those systems is the City of Portland and Multnomah County's Joint Office of Homeless Services, the natural next step after a Home for Everyone. The Joint Office's work over the past 4 years has helped tens of thousands of people while showing the promise of shared priorities and coordination. And I would be remiss if I didn't take this moment to thank the staff at the Joint Office. The way in which each and every one of you have stepped up during the pandemic is nothing short of incredible. You have kept giving everything you have, and these are folks who will never accept that something is impossible when it comes to protecting our most vulnerable neighbors. I know that people look around and see the sheer number of people in crisis, and they wonder whether that partnership that I'm talking about has actually done any good. Well, let me tell you, it has. In 2015, the county and the city and our partners were supporting 6,000 people in housing on any given night. Last year, on any given night, we supported more than 12,000 people in housing. These are neighbors and community members who might otherwise be on our streets or hoping for a space in one of our shelters. But they're in housing now because of our support. Of course, it's nowhere near enough. And the fact that so many more people could find housing, even as our overall homelessness count has stayed flat, shows us just how strong the headwinds are. But it also shows us what can happen when we focus on the only thing that actually ends someone's homelessness: a home. And that is the answer to the question of how we take care of our neighbors experiencing homelessness. But of course, that answer is too tidy, because when we talk about connecting someone to a home, we're not just talking about an apartment that someone can afford. We're also talking about the support services that they need to stay in that apartment. People don't need to wait until they're ready for housing. It's the system that has to be ready to offer people the supports that they need, whether it's behavioral health treatment, job skills, training, or something as basic as childcare. Housing shouldn't be a reward for recovering from a struggle with substance use. It's what helps someone recover in the first place. And yet right now, while that work is underway, we also know that there are still thousands of people who can't afford a place of their own right now. But just because they can't afford a home doesn't mean that they don't deserve a safe, warm place out of the elements. A place where they can find community, where they can find hope, and where they can find a chance to get back into housing. So we've set to work these past few years, listening to people with lived experience and remaking and growing our shelter system at the same time. Since we declared a state of emergency in 2015, we've doubled the number of year-round beds that local government pays for, from just under 700 to now more than 1,400. Shockingly, those new beds were the first that this community had added in 10 years. But that really doesn't tell the whole story, because we didn't just add shelter. We've changed what shelter means. Our shelters now welcome people as they are, whether they're in recovery or not, and to get them the support they need once they come inside. And we've added them all across our community, not just in downtown. We are meeting and helping people where they are. And these new shelters are open 24 hours, so people don't have to leave in the early hours of the morning and wait in line at night to get back in. We've also embedded services like housing navigation and access to physical and behavioral health supports. And we got rid of some of the other barriers that also used to keep people from coming in. We now welcome people with their pets, their partners, and their personal belongings. We also added year-round shelter specifically for families, where each family can find quiet and calm in the privacy of their own room. Partnership also means that all of our systems can work better together without the silos that might have kept someone from the services that they need. I learned about a couple, Kenneth and Anna, who had lost their housing and they wanted to come into shelter, but they didn't want to have to split up to do it. And although their caseworker was from a service provider that worked with youth and young adults, he found them a spot at one of our new couples shelters. Once they had a safe place to be, several different providers came to help them. Kenneth and Anna sought out counseling. They took a renter education class. They pursued job training, and they worked to have their records expunged. And they worked to apply for supportive housing. With all of that support, they were able to leave shelter and go directly into an apartment of their own. And that's the outcome we want for every person who's in our shelter, every person on our streets, a safe, stable place to call home. A response that works the way it did for Kenneth and Anna is the kind of response that we've spent the last 6 years pursuing, which brings us back to the current moment. As the local public health authority and the state's largest social safety net provider, making sure that our most vulnerable community members were kept as safe as possible was exactly Multnomah County's role when the pandemic hit. The challenge, of course, was in quickly building an effective response to a disease that we were learning more about with each passing day. Luckily, Multnomah County has a truly top-notch public health team, including Dr. Jennifer Vines, who only recently had taken over the role as lead public health officer to guide our steps and protect people living outside.
So in those earliest days, we had limited testing and we were essentially flying blind. We knew the virus was here, that it spread easily through close personal contact, and that it was most serious for the elderly and those with poor underlying health. So the situation immediately laid bare the risk to community members living in shelters and on the streets. We have no vaccine for coronavirus at that time, and our understanding of the virus itself was still quickly emerging. We didn't know then how many people could have the virus and not show symptoms, or how easily it could spread through basic human actions like talking in close proximity or singing. We were looking for lessons from other large cities, but as far as I could tell, we were all in the same boat. There was no playbook for this virus. So we had to go back to the basics of public health, separate sick from well, and give extra protection to those known to be at higher risk of severe illness. That meant spacing people out in shelters, screening for symptoms, setting up a place to safely put people with symptoms, and gearing up to get those at highest risk quickly into their own private housing. We didn't know then that masks worked really well to lower the risk of transmission. And more importantly, they were in short supply and reserved for people with symptoms and healthcare workers who at the time were expecting a wave of severely ill people.
So in consultation with Dr. Vines, our epidemiologists, and our communicable disease team, the county immediately got to work adjusting the way our shelters looked and operated, creating ways that would minimize the risk of a shelter outbreak just as much as possible. Before COVID-19, we already had experience in activating shelters during emergencies because every winter we call into action our severe weather shelters and outreach efforts to move quickly to make sure that people are safe from the worst conditions of the year. We started making progress within a single day, and within a matter of weeks, we had developed an evolving COVID-19 response to help people experiencing homelessness find safety in our shelters, and to the furthest extent possible, safety for those out on the street. That started with some fundamental steps. We knew we had to create physical distancing in our shelter system, and we knew that we had to provide personal protective equipment, PPE, and basic public health guidance to providers, volunteers, and especially to thousands of people in our shelters and sleeping outside. Immediately, we started moving people in shelters with respiratory symptoms away from people who didn't have those symptoms. We worked with our trusted community partners, Transition Projects, Do Good Multnomah, and Human Solutions to supply face coverings and to create new guidelines around cleaning, staffing, and other protective steps. At the same time, we spent days working with outreach providers and volunteers like Portland Street Medicine and Street Roots to blanket the county, bringing protective gear and COVID-19 information cards to people living without shelter. But we also knew from the very start that none of this would be enough. So we kept listening to our health experts, and we kept pushing. And in just a few more weeks, we added proper space for physical distancing throughout our shelter system. We moved hundreds of people from our original shelter system and even from some community rent spaces, like Right to Dream 2, into 4 public buildings that had been left empty by the pandemic: the Oregon Convention Center and 3 community centers owned by Portland Parks and Recreation. At the same time, day spaces were closing, meal supports were lacking, and the providers who were able to safely stay open found themselves overwhelmed with demand. So we worked closely with Catholic Charities of Oregon and the Blanchet House to help fund thousands of meals a week. The Joint Office's Winter Supply Center, located in downtown Portland, turned into an all-year COVID supply center for outreach teams, for community organizations, and for volunteers. And it's still distributing resources to people living outside to this day. The city and the Joint Office worked with advocates from Street Roots and others to create 3 outdoor emergency campsites. And our partners at the City of Portland placed portable bathrooms and toilets near places where people camp all throughout our community. But that was still just the immediate and initial push. Inevitably, we knew that there would be people seeking shelter who had coughs and fevers. Remember, this was still late winter, flu season, on the way to spring and allergy season. And we also knew, by the very nature of homelessness and who it hurts disproportionately, that we also had to protect those who would be most likely to become severely ill and even die from COVID if they got infected. People with underlying health conditions, senior citizens, people from disproportionately affected communities of color. We had to take extra precautions in order to keep them safe. So over the spring and summer, in consultation with our public health experts, we explored adding 2 kinds of spaces: physical distancing motel shelters for those who are most vulnerable to COVID-19 but don't have any symptoms, and voluntary isolation motels for those in shelters or campsites, or even people in crowded family living situations who have symptoms and need a safe place to isolate and obtain testing with health supports on site. So we put out a call to the community. We asked motel operators to partner with us to provide individual rooms for vulnerable people. And they came through. The Jupiter Hotel called my staff before we actually called them. And in March, they hosted the first of our 2 isolation motels. And by June, we opened the first of our 5 physical distancing motel shelters. Thanks to those spaces, we were able to leave the convention center and our community centers and offer better protection, along with the usual suite of housing and health supports offered in our shelters, to nearly 300 vulnerable people who needed a safer place to be than in a congregate living setting. That was a huge lift. And I want to make something clear. Because of that work, we avoided losing a single shelter bed that we had before the pandemic, even as we followed the physical distancing guidelines that we were given to keep people safe. I couldn't imagine what it'd have been like if we hadn't done that work, if we had had to turn hundreds of people out of our shelters, away from our services and stability, and back onto the streets. That would have been a tragedy, and I wasn't going to let that happen. It's a testament to our preparedness, to our practices, to some luck, and to the flexibility that we've shown to keep following the science, even as the science evolves.
As of this moment, we have not identified a large outbreak in a shelter or campsite setting. I believe our early efforts have helped us get this far. That said, we are moving into a time of rapid virus spread and have to be cautious as we move into the winter months and the reality of COVID fatigue among so many who've been working so hard for the last 10 months. Working in our favor are our incredible partnerships and compassion of our county staff. Unfortunately, spread of infections among our unhoused neighbors is not new. Public health has a long history of working with individuals with infectious tuberculosis, housing them until they're no longer infectious, doing contact tracing, and supporting them to get through months of antibiotic treatment. When the pandemic started, our communicable disease and sexually transmitted disease teams were deep into a response addressing an increase in HIV, syphilis, and Shigella among marginalized community members, many of whom did not have stable housing. We need to continue this full set of efforts and find ways to boost them in order to get through these colder months with all of our communities intact.
All of the work that we've done, all of the work we're doing at this moment, and how we're preparing for the duration of this pandemic is impossible for the Joint Office of Homeless Services to do alone. Over the years, the Joint Office has built relationship after relationship to respond as a community to the basic needs of people experiencing homelessness. This partnership includes service providers, treatment providers, affordable housing developers, health clinics, restaurants, religious organizations, neighborhood associations, and volunteer groups. And all along the way, a home for everyone and the Joint Office have made sure that all of these partners knew that they had a seat around this really big table. This deep bench of partners is an essential pillar of our homelessness response, alongside other things like our facilities and severe weather protocols. When emergencies like cold weather and the pandemic threaten the health and safety of people living outside, we don't have to use precious time to find those who are willing and able to help. We know exactly who we can call. And we have a really good idea of how each partner can contribute to the overall response. The shared understandings of the rhythms, the coordination, and the logistical nuances that we've built together over the years allowed us to hit the ground running. And that couldn't have been more critical as we trend on our response to COVID-19.
None of these efforts have been simple. Our Joint Office of Homeless Services has helped establish a direct line to community-based partners. As we developed public health strategies, we brought in those partners early to see what would work and what wouldn't. We had to test our assumptions against the realities of serving this population. That process has helped us to refine our response and realize that our role is not just to protect those living homeless, but to give confidence to those partners that we are doing everything we can to protect their staff and volunteers. For those living outside, we've offered a framework to the city about weighing not dispersing groups and potentially spreading the virus against more immediate health hazards like untreated human waste, uncapped syringes, and groups that make it difficult to allow at least 6 feet of distancing in public spaces. As I speak, many dedicated individuals are tackling the huge challenge of getting people inside on the coldest nights this winter, while at the same time minimizing risk of COVID spread.
The better our response to the crisis of homelessness, the better we're positioned to help vulnerable people during other crises. We are incredibly fortunate to have this infrastructure in place to keep people safe so far through the pandemic. And we also saw our preparedness pay off during the wildfire and toxic air events in September. We took the relationships that we'd built and deepened throughout COVID-19 to quickly open clean air shelters 9 days in a row, while also getting out more than 30,000 masks to people across the county. We also see so many other crises that overlap and play out on individual scales that without intervention trap them in homelessness. Their physical health, their involvement with the criminal legal system, unmanaged mental health challenges, untreated addiction. But the oppressive weight of each of these crises that keep people from finding stability, wellness, and opportunities to thrive can be lifted, at least in part, by access to housing. As we continue to provide shelter and connect people to the limited housing stock that we have, bringing more affordable and accessible housing into our community is the outstanding body of work that is still ahead of us. Just imagine what our pandemic response could have been like had we had the resources to invest even more in the ways that we care for our neighbors living outside. Or imagine if we had a meaningful inventory of affordable, supportive housing as this pandemic approached. Way back when the governor ordered our state to stay home, save lives, what home did our houseless neighbors have to stay in? This pandemic laid bare the costs of not having enough housing and support on hand for everyone in our community. As long as we don't have enough housing, even with a robust homelessness response infrastructure, and no matter how swiftly and nimbly we're able to react, we're going to be playing from behind to keep our neighbors safe and healthy. And as long as we don't have enough housing, and as long as our society is held up by systems with inherent inequities, we'll have to keep answering the question, how do we take care of our neighbors experiencing homelessness? The answer is to invest in the future that we want to see, to make sure people have a safe place to sleep, to build more affordable housing, to provide connections and relationships to guide people into housing, and to make sure they have the support they need to stay housed. The good news is that we've already begun that work, and the community is standing with us. 3 years ago, former Portland City Commissioner Nick Fish and I stood together and promised 2,000 more units of supportive housing by 2028, almost doubling the number that we had at the time. And I'm happy to say that we are well on our way to meeting that goal. And then came Here Together, and the ballot measure for supportive housing that voters overwhelmingly supported just this last May. These Here Together funds will also be used for our future Behavioral Health Resource Center, which will give people experiencing chronic homelessness downtown a single place to go to take care of their basic daily needs, to receive peer counseling and behavioral health and substance use treatment, and to find shelter and transitional housing too. That so many of us voted for this measure proves that our community understands that ensuring people have sustainable, supportive housing is the work we must all share. It's the work that I was committed to when I first entered county office, and it's the work I will keep doing until my last day as Multnomah County Chair. This is the work that we all have to keep doing before the pandemic, during the pandemic, and after the pandemic, until we don't have to ask that question anymore.